Welcome to the chapter on ferrets. I keep saying chapter because I use these materials also for a different class that this actually is a chapter. Oh, ferrets. Y'all are in for a fun ride. This is my favorite section. So, as we have been saying all along, our objectives for all of the animals that we're working with is being able to specify methods of clinical assessment, list common health conditions, identify common parasites, as well as potential zoonosis, specify reproductive, anatomical, biological, and treatment nuances, and then explain enrichment as it pertains to these species. Ferrets, here's your blank page. Are they USDA regulated? What's their gestation? How do you tell their sex? This is where you're going to make those notes. Meds to avoid, sample collection sites, all of that is in there. So ferrets are well named. Their Latin name is Mustela pittorius furo. Mustela is literally a weasel, Pittorius is evil smelling, and Furo is a thief. So really, ferrets are called an evil smelling thief weasel. And of course, as we all know, it is Weaselton, not Weaseltown. Why would we use ferrets? They are biologically and physiologically closer to humans than rats and mice. Their lungs are nearly identical to humans in regards to function and disease susceptibility, and their oestrus cycle is very similar to women's. They can be used for an array of work, including influenza, SARS, COVID, neurobiology. They are replacing cats in pediatric intubation clinical laboratories. They're used for cardiology, neuroanatomy, and neuroendocrinology. They're just a neat animal. They are the order Carnivoria, so that's important to know. These are our first carnivores. Biological data for this species is going to be a lot different than that of our other species because they are in fact a carnivore. This is a species with, say it with me, drum roll please, dun-dun-dun-dun-dun-dun-dun, canines. So their dental formula, they have incisors, canine premolars, and molars. Different numbers on the upper cartridge versus the lower. You can get a couple of nice views on these images here. Biological data. These are big animals, 800 to 1200 grams. They can live 5 to 11 years. Their body temperature is the highest of the animals that we will talk about, so 100 to 104 degrees. Heart rate, 200 to 400 beats per minute. Respiratory rate is actually a little slower than a lot of the animals at 33 to 36 breaths per minute. They drink a lot, they eat a lot, they pee a lot. Their food consumption is very specific. These are animals that have to have pretty much a keto diet. So high protein, low carb, low fiber, and a lot of it a day based on their body weight and their sex. Boys will eat more than girls. These are meat hunting animals, so giving them small, frequent meals is definitely better than giving them big meals all at once. These animals do not have the intestinal flora to break down complex carbohydrates. That's why we don't want to give these animals a lot of fiber. Their gut just can't do it. It'll give them diarrhea, it'll give them some bloating, it's going to make them miserable. Acceptable foods for them, ferret diets, and also cat foods. Cat foods are very similar because cats are quite similar in their intestinal structure. And again, multiple small meals because their intestinal tract's pretty fast. It's very efficient, so they don't need to have reproductive data. Some interesting things, these are not terms that we're going to have heard in other species we've studied. So the male is a hob, the female is a gill, and the babies are kits. Sexual maturity is 4 to 12 months. Their gestation period, this is really neat. If they haven't had a litter before, their gestational window is 41 days, but if they have had a litter before, it's 42 days, and they're pretty much to the letter on that. Litter size is about 8. They get weaned at 6 to 8 weeks, similar to kittens. They are prone to dystocia. They are also prone to pregnancy toxemia, just like guinea pigs. Sexing, the males are pretty obvious. You can feel the os penis. You can actually feel that bone in there. There is also a greater anogenital distance, and you can clearly see the prepuce on the ventral abdomen. The female, there's a single urogenital opening, and that's near the anus, and there's, like with the rodents, a smaller anogenital distance. You will want to know how to sex these animals. Husbandry for these guys is a lot of fun. They are a USDA regulated species, so it is very important that you're following the Animal Welfare Act, and if you're federally funded, the Guide for the Care and Use of Laboratory Animals. Housing is very similar to cats. You can house them in a cage or in a pen. They do need some sort of a den area. They really benefit from having toys. These are very playful animals. They need opportunities to exercise. They need to be able to move their body in normal ways. These animals are, like rabbits, very, very susceptible to heat issues. You can cause a heat stroke in these animals if they are being housed in an ambient temperature higher than 86 degrees. It is preferable to keep the adults at 40 to 65 degrees. I know that seems cold, but these animals do not like it hot. If you've got babies, you can go warmer because they do get chilly. In a lab environment, we do tend to keep these animals right around 66, 67 degrees. Where did my mouse go? Species typical behavior. These are very curious animals. I mean, they are weasels. They will explore, they will play, they will run around, they are going to exercise themselves. They like to burrow, they'll chew on anything and everything. They like to forage, and they are a social species, so they need to be housed in a social situation. They really can't be housed alone. This is a really neat video from the Smithsonian Institute National Zoo, one of my absolute favorite zoos. Trigger warning, if you have an aversion to animals hunting and possibly killing live prey, you might want to skip forward on this and not watch this video. The reason that this video is important is these are black-footed ferrets, which are an endangered species that have been housed in a survival type environment, much like we do the condor chicks at the Oregon Zoo. And like the condor chicks, they get released to the wild. So these animals actually have to learn how to hunt and kill their prey before they can go out and be released. But again, if this is not your jam, you don't need to watch this video. Let's see if I can get it to go. So enrichment in a paper bag with a bunch of shredded paper is a really fun enrichment source for these guys. The bag's going to make noise, it's going to move, it doesn't just stay static, and you can see them doing the little doot doot doots that they do when they're playing and are excited. Oh, running inside, running all around. So they are gaining very valuable experience by playing with that particular type of enrichment. Other ways that we provide them enrichment, they like to swim, they like water, they are hammock dreamers. Like if there's a hammock, they're going to be in it, and they're kind of embarrassing because sometimes they fall out while they're sleeping. They like tunnels, they like just pretty much anything you can think of. These are a species you get to be very creative with when it comes to enrichment. Here you've got a very nice robust kennel type situation. So they've got nice thick bedding, which you can use for foraging. They've got boxes with shredded paper. Again, you can use that for nesting or foraging. These ferret balls are lovely. They will, if you put fleece in them, they'll pull the fleece out. They just have a party. They're a lot of fun. I know I'm saying that way too much, but I really love these guys. Okay, ferret play and movement is unique.
Ferrets are really
these
neat.
Animals
It's
don't
almost
move the
as though
same
you
way
have
as
an
other
animal in
animals,
liquid form.
and it's important to know how they
have a really
move
well-adapted
so that you
body
can
design.
recognize abnormalities, and that is why I have included
By filming
this
the
video.
ferret in slow
No
motion,
trigger warning here. This
Angela
one's
can
just
see
cute.
exactly what the ferret is doing.
When they're moving around above ground, they have an arched back posture. And as they enter a tunnel, they seamlessly lower that posture in their back until their spine is stretched out.
This flexibility in their spine is due to a unique set of back vertebrae. In other animals, protrusions, known as processes, on each segment of the spine stop it from moving too far. In ferrets, these processes are thinner, creating flexibility and movement. So, their spine can stretch out when they go underground, making their body 30% longer. This footage shows how easily the ferrets can transition from above to below ground. But these animals are predators. So what impact does this maneuver have on the ferret's speed? The black and white backdrop helps Angela determine how fast the ferrets are traveling across a set distance. When the footage is lined up, it reveals something completely unexpected. The ferret barely loses any speed at all when running underground.
Their shorter than average limbs allow them to still be able to move very well, and they aren't restricted in the limb movement in that position.
In most carnivores, the legs and body are about the same length. But in burrowing mustelids like the ferret, their legs are only half the length of their body. This means they can run in enclosed spaces without tripping over their own limbs.
How neat is that? And we'll talk a little bit more about their normal body movement when we get into the clinical section. Okay, clinical section. But first, let's start with some other fun ones. So ferrets, pet ferrets, lab ferrets, they are prone to some pretty unique clinical issues. Hyperestrogenism, insuloma, adrenal tumors, distemper, rabies, influenza. These are things that can absolutely plague pet ferrets. So when it comes to clinical signs, and I'm sorry that, wow, the font on this is small. Weight loss is a really important one. So too is a straight back. So in both the enrichment video and the movement video, you should have seen that the ferret that wasn't underground, they arch their backs. If a ferret's back is straight and they're not asleep, if they're walking with a straight back, that is not a good sign. You're going to want to watch that ferret a little bit more carefully. Vomiting is a very critical sign because while ferrets can vomit, it is rare for them to vomit. Ataxia, nausea, swollen vulva, we'll talk about that, pale mucous membranes, hair loss. And we don't talk about hair loss with other species as a clinical sign, but in ferrets it absolutely is. Coughing, sneezing, and behavioral shifts. If you have a normally placid, sweet ferret that suddenly becomes aggressive, it could be a problem. So our non-pathogenic concerns: hyperestrogenism, insuloma, adrenal tumors. So those aren't things that they can catch from other animals, but they are a problem. So with I cannot say this today, my apologies. This is an issue for these animals where they're producing too much estrogen, they're in estrus for too long. These are animals that are induced ovulators. So they ovulate once they have been mated. If they are in estrus and they don't get mated, they end up with an estrogen toxicity, and that can result in a bone marrow suppression, which causes aplastic anemia. This can make these animals critically ill. It's only applicable to the females because males don't go through a heat cycle. We also see this in cats. So if those of you who remember your cat's history and remembering that cats need to be spayed if they're not going to be used as breeders for exactly this reason, so too ferrets. A lot of pet breeders are going to spay the animals before they leave the breeding facilities. They'll also neuter the males. They'll often do a scent gland removal, and that helps this issue occur a lot less, so you may not see it in clinic. The clinical signs are that prominent vulval enlargement, so it's gonna look huge. They're going to have very pale mucous membranes, almost white. Bilateral alopecia is very common, and then having petechia, bruising in the mouth mucous membranes. Treatment for this is surgery or hormone chemical castration. You can do supportive therapy with iron supplementation, B vitamin supplementation, or even blood transfusions. Question for you: what are induced ovulators? You will want to know that ferrets are an induced ovulator. Insuloma, this is where you have a benign tumor in the pancreas, remembering that oma is a tumor. It is a tumor. In this case, it's the most common tumor in the ferrets, and it's literally on the pancreas. It impacts the islet cells of the pancreas. It increases insulin. The insulin drives glucose into the cells. Then the blood glucose is going to decrease, causing a hypoglycemia. With that, the brain and the red blood cells are going to be short of that sugar, and that is a death sentence potentially. So please know that there is a tumor in ferrets associated with hypoglycemia, and that is an insuloma. Clinical signs are weight loss, vomiting. Remember, we said ferrets very rarely vomit. Ataxia that improves if you give them a sugary snack. Nausea. You can diagnose this based on the clinical signs. You can also do blood tests to look at glucose levels. And you will also want to do an absolute insulin concentration so that you know what you're dealing with. You can treat this medically with prednisone. You can give diazidine, which inhibits insulin secretion, or you can change their diet. But it is recommended to surgically remove the tumor. Adrenal tumors are the second most common neoplasia. This is going to occur when a ferret's glands start overproducing sex steroids. Your clinical signs are bilateral alopecia, vulval swelling, And diagnosis is going to be based on history, clinical signs, ultrasound, looking at the sex hormones, having an assay on that. Confirmation at surgery. You can also do an ACTH stim and dexamethasone suppression test, but they usually come back normal. With the adrenal tumors, prevention is preferred. You can actually give an implant that will cause basically a chemical neutering. You can use this in conjunction with surgical neutering, and you can start this as soon as 1 year of age. The treatment can be challenging. Surgery is the probably best treatment. You're going to typically remove both of those adrenal tumor glands because this is often bilateral. Okay, pathogenic concerns, distemper, rabies, influenza. We don't worry about influenza too much with our animals, but this is a species we do. Ooh, good distemper pictures. So these animals can get canine distemper. Clinical signs, they can have rashes, they can have neurological issues, they can have photosensitivity, they can have really nasty nasal discharge. With the neuro phase, you'll see ataxia, tremors, paralysis. Now, with the catarrhal phase, you don't always see that, and they can go straight to the neuro phase. Another thing that's inconsistently reported in the journals is the hyperkeratosis of foot pads. So that thickening, that's what this is, the thickening of the foot pads. Sometimes it's seen, sometimes it's not, but if you see it, I would definitely be concerned. This is a supportive care. There is no cure for this. There is, however, a vaccine. So hopefully these animals that you see are getting vaccinated. You can do pre-medication with a Benadryl, diphenhydramine. You want to do this series at 6 to 8 weeks of age, and they should be getting boosters until they are a year old, and then boost again annually every 2 years. Rabies, I have not seen an Oregon ferret reported for rabies, and I'm glad for that. We should be using an inactivated rabies vaccine that is licensed for use in ferrets starting at 3 months of age and then boosting annually. Influenza is a really interesting one because we get it, therefore they can get it. I'm going to try to get this link to work. We'll see. We know I'm 50-50. Nope. Okay. That's always fun. Nope. So if you want to see influenza in ferrets, you are welcome to click that on your own. I'm sorry that my YouTube stuff is just terrible. So ferrets are highly susceptible to the flu, which is why we can use them for research. They can catch the flu from people and from other ferrets. So if you're sick, they can get sick. Clinical signs are fever, upper respiratory tract symptoms, and then you have to rule out distemper because that's also... Now, I have this in here under the diseases, but it's really part of the clinical care, and that's anesthesia. Ferrets are unique when it comes to being anesthetized because they can hold their breath. So there's two things that happen with ferrets. They will hold their breath if they are smelling an anesthetic that they don't like. So we like to use SIVO for that because SIVO doesn't have a scent where isoflurane does. And anytime you're working with a ferret, if you've got a ferret come in, Get the temperature as soon as you can and do it while the animal's been quiet. So if the animal has come in a crate and it's just chilling in the crate, that's a good time to get its temperature. If it's been in, the office running around greeting everybody, you're going to need to wait. And that's because any overexcitement that they have can cause a spike in their body temperature. So you want to get their temp while they've been calm, cool, and collected. Okay, there is your ferret chapter. As always, please reach out to me if you have any questions, and have yourself a magical ferret day.